Okay, let's try this.
Okay, now it's good. Okay, so no problem. Welcome, everybody. Just a few housekeeping items. At the end of the webinar, there will be an anonymous 4-question survey, so we would appreciate your feedback. If you have any questions throughout the webinar today, please go ahead and chat to the hosts and the panelists. And then everybody who has registered for this webinar will receive a link to the recording of this webinar in just a few days. Go ahead and go to the next slide. Today's topic, finding joy in good works. So please welcome our presenter, Katie Keckman. And I'm just going to read our disclaimer and then she's going to take it away. So next slide. The information provided in this presentation is intended solely for the general information of the audience. It's not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. So again, please welcome our presenter, Katie.
Oh, thank you so much, Laura. Hello, everybody, and welcome to our Finding Joy in Good Works workshop. And today we're going to discuss taking a step outside ourselves and giving charity a try. And good works do have a direct effect on our physiology, and we'll talk about how in today's webinar. And as mentioned, my name is Katie Keckman, and I'm a senior health education specialist from Sharecare, and I'll be leading our time together today. And if you have not had the opportunity of joining one of our webinars, I do want to let you know that we've elevated our webinar experience to include expert video content and interactive activities, and of course, a group discussion. So you'll notice periods of me playing and pausing the presentation as we watch various snippets of various video snippets and engage in conversation together. So I do welcome any questions, comments, or experiences that you feel comfortable sharing throughout the presentation. Since you are all on mute, please just type in the chat and I'll read it out loud. So displayed on the screen is our agenda, and we have several objectives for today's workshop. First, we'll have an introduction of charity work, followed by the impact of charity work, and we'll then discuss the health benefits of giving. And we'll talk about philanthropy, inspiration, and then finally, I'll send you off with some key takeaways from today's workshop. So let's go ahead and get started, and we're going to watch a snippet on the health benefits of giving. And you're going to read words on the screen, but they're not going to be spoken out loud. So just background music, but I will recap afterwards if you do happen to miss anything. I hope you enjoyed that video. And as promised, to recap, Cleveland Clinic reports that giving is good for both your physical and mental health, and helping others has been shown to decrease your blood pressure, depression, and stress levels. It can also lead to boosted self-esteem, increased happiness, and just an overall longer lifespan. So helping others is really a win-win, not only benefiting the people that you're helping. And those who have suffered coronary related events like heart attacks have been shown to have an improved recovery when they engage in supportive interactions. And the video segment showed that those people who are aged 55 and older who happened to volunteer for at least 2 different organizations had a 44% lower mortality rate, which I think is huge, over the course of 5 years than those who didn't take the time to give back to the community. And those results did account for age, bad habits, exercise, and just general health factors. It's also been reported that MRI scans show that our brains emit feel-good chemicals called endorphins when we do something even just as simple as giving a gift to somebody else. And another study showed that receiving help from other people didn't reduce their mortality risk. It's only when someone offers help do they reap those benefits. So given all of this research about how giving rather than receiving promotes longevity and wellness, then interventions should be designed to emphasize what you can do for others instead of being designed around how you can feel supported, which they typically are. And Stephanie Brown, a psychologist at Institute for Social Research, said that simply by wanting to be able to help the ones you love can have a really great impact on us. And being motivated to stay alive and prolong the amount of time you can contribute to family members can increase older adults' fitness and longevity. And evidence also said that if you have a quote unquote fighting spirit, you can live longer with cancer than those who have more of a helpless or less optimistic mindset about their survival chances when they have cancer. So there's great benefit to having hope and being positive. And I'm sure you have heard that before. But I think that's a little different that I certainly learned is having a giving spirit now seems to have that same effect. So what can I do to help others? And actually wanting to is key. So I'll pause if anybody has any, does this surprise anybody? Does anyone have any thoughts, comments, questions? You can type in the chat if you want to share. And while I'm waiting, if anybody does have anything that they want to share, any reflections. So the slide on the screen covers different ways of giving. You can certainly take a screenshot if you find it helpful. And I'd love to hear from you if you also want to share different ways of giving. So on the screen, we have time. So like donating your time, philanthropy, maybe working with children, assisting senior citizens, educational assistance to help people learn to read. I'm just giving some ideas. And again, feel free to share. Supporting healthcare causes like fundraisers, walkathons, or other events, campaign donations, protecting the environment, joining active groups in your community, registering people to vote, feeding hungry people and families, or helping the homeless or unhoused, volunteering at a hospital, just finding meaningful ways to donate your time. And service, like cleaning parks, roads, other public spaces, providing goods and services, or offering emotional support. So those are some different ways of giving. And again, I'd love to hear from you. Does having a job count? I don't think, I think the idea is, volunteering your time, kind of out of the goodness of your heart wanting to help, not like a transaction. I attended a volunteer fair offered by our community. It was a great way to learn what organizations need assistance. Thank you so much for sharing that, Laura. I think that being in a 12-step program gives me the ability to work with others and help them. I love that. Thank you for sharing. I was an e-mentor to a student this year. We exchanged letters, which helped the student practice writing and reading. I think I learned more than the student. Oh, I love that. How about activism as a form of giving? Yeah, I definitely think it's kind of like the, intention behind it. Like I said, the wanting to help others and the it has like just a significant impact on its own. Exchanging your gifts in community, listening as a way of giving. And I teach yoga, and actually I was thinking as we are going through this of a way that I could, volunteer my time or a service. And I think maybe teaching a community free yoga class is a way that I'm now after this webinar going to donate my time. Listening as a way of giving, absolutely, like offering space, holding, and that giving your time and energy to somebody else, and that's included in the emotional support. The high school students in our community are required to do volunteer hours. I love that. I don't remember way back when I was in high school having to do that. I joined a community group and I've taken minor leadership roles. That's fantastic. So does anyone want to share if they've noticed benefits from doing that? So those of you who do who are volunteering in the community or offering the emotional support or your service time, have you noticed any benefits? I always feel good when I volunteer. So do I. It's definitely a feel good experience. It does feel good to be helpful. Absolutely. Well, thank you so much for sharing. So let's move on, and I'm motivated to give again. Oh, I'm so glad. Yeah, if you take anything from today, it's maybe just, a little motivation or encouragement to give back and share your gifts. So we're going to now learn how kindness is contagious. And this is one of my absolute favorite segments. Someone else said, I also participate in blood drives and I become a frequent donor. That's wonderful. Thank you for sharing and for your service. All right. Playing the video.
We've missed something big, something that will help us become stronger, be more resilient. It's kindness. And we've seen it every day, on our streets, in the grocery store, at the park. Kindness is a social contagion. Social contagion's the spread of emotion from one person to another. Anyone, anywhere can sneeze kindness on your brain. How does it feel when someone genuinely and spontaneously is kind to you or kind to someone else? It lifts you up, it warms your heart, it gives you hope. Every time you see an act of kindness, someone has infected you. The more infected you get, the more you can spread this infection to others. And before you know it, you're kind to others, not because it's the right thing to do or because you want others to see you doing it, but because it feels right, it feels good. You see, kindness kills. It kills our fears that people who don't look like us are dangerous. It kills our worries that we're alone. It kills our anxiety and inoculates us against uncertainty. So go ahead, spread kindness as the new contagion. Help that kindness curve go off the charts. Kill everyone with kindness, because that's how we'll become stronger together.
So I loved this message and metaphor about kindness being a contagious pathogen. And especially, during and after COVID, it just seems kind of relevant in all of our lives. And we did just learn how kindness is a social contagion, the spread of an emotion from one person to another. And seeing and spreading acts of kindness, giving and receiving, lifts you up and it warms your heart and it gives you hope. The more infected you get, the more you can spread to others. So being genuinely kind to others just simply feels good and right. And kindness kills our fears against anxiety and worries that people aren't like us. I liked that part of the message. The message to kill everyone with kindness so we can all become stronger together is a really powerful one. So since being kind feels good, when we're mindful of how we feel when we're being kind, it resets our brain to default or to begin defaulting towards kindness. So let's go through some of these mindfulness questions together, and I would love to hear from you. What are small acts of kindness that you do subconsciously? And maybe it's holding the door for the person behind you and you're waiting a little bit longer. You can also answer any of the, what are small acts of kindness that others could do to improve your mood? I think they're all related. So if you want to answer anyone, smiling at people and looking them in the eye instead of avoiding them. Oh my gosh, yes. I do feel like after COVID that shifted, or the pandemic, where people were less inclined to do that. And I think, something so much as a smile and eye contact and make people feel more connected. And it is just a kind act and, it can make the other people smile. So again, it shows the contagious smile, offering food, telling a neighbor when a package is on the doorstep. I love that. I personally, all my friends tease me, but one thing I often do, I pretty much whenever I go anywhere, I compliment strangers. And definitely I'm a big complimenter, even the friends and just people I'm interacting with. And then my thought process is if I think something nice about somebody, I try to say it out loud because it could make their whole day while also making me feel good. Someone said, I'd like to pay for the person behind me in the drive-thru. Oh my gosh, I love that. Yeah, the pay it forward or like the Starbucks drink or adding money to an expiring parking meter. Oh, that is a good one. They're great. I started talking to people while in a waiting room, the grocery store, and more. Well, thank you so much. Those are all really great suggestions. And even if you didn't share, maybe just take a moment to think about it. Waving to neighbors as I drive by. I grew up, like my parents have a house on Kent Island. It's like off the Chesapeake Bay. And I live in Maryland. And so I grew up kind of like boating and being on the water. And I just noticed that being on the water, it's like everybody, it's weird if people don't wave to each other, but it's so different on land where it's almost weird when people do wave at each other or not, weird as in just kind of different. It's not as common. So I love all of your guys' suggestions. And after hearing your responses, it sounds like being kind or having a kind act done for you consistently results in positive feelings. And we all want to feel good. So if we can recognize this feeling when we perform kind acts, it can help reset our brain to be kind more consistently. And the goal is to live in the present moment and appreciate those positive feelings so that the act of kindness just comes more naturally. So try to be kind to everyone and often. And remember, the more infected you become, the more you will spread. Someone said, when I'm getting served by a bank teller or server or a checkout clerk, thanking the person for their cheerfulness. Thank you for sharing that. I like that one. So next, we're going to explore a video on sharing compassion with caregiving.
Linda was diagnosed with Alzheimer's about 5 years ago. So my role has changed, but it's still a very happy marriage, and we keep moving forward. I had to get our daughter, I had to explain that mom has Alzheimer's. It was very emotional. I tried to sign up with every clinical trial, but the disease had progressed too far. Not one caregiver can do this. It's impossible. You need a core of people that care and really help. My outlook is help her in any way possible. Never, ever get mad. If you have to answer the same question 10 times, you answer it 10 times. It's not killing you. It's the person with Alzheimer's who is the one that is brave and doing the best they can. I'd say the treatment now is we are very, very happy together. We hold hands, we hug, we exercise whenever she's able to. Is any of it going to cure the Alzheimer's? The answer is no. But does it make it fun? It really does.
Okay. It's him.
It also, I think, slows the progression as much as possible.
I like you.
It doesn't get better than that. It does. You're being realistic. The disease progresses. Stay as healthy as you can and hope for a cure.
That definitely pulled at my heartstrings. And we just heard from David, and his wife Linda has Alzheimer's and he's her caregiver. And he tried to sign up with every clinical trial possible, but her disease progressed quickly. And Linda, 67, was a successful business executive until her Alzheimer's diagnosis. And David explains his journey and outlook and stated that he's just doing the best, that she's doing the best she can, and she's the brave one. And I like his point of like never getting, or his advice on never getting mad or frustrated. And just, you can tell like he offers immense compassion, even if he has to answer the same question 10 times. He said, it's not killing you. You can answer that question 10 times. And the treatment now for them is just that they're happy together. They hold hands, hug, exercise, and just try their best day in, day out to have fun. And again, he recommended just staying as healthy as you can and, you know, hoping for a cure. So let's take a moment to look at the screen. And if you want to just think about it, you can jot some notes down if you don't want to share, or you can share in the chat. How are you sharing care? And you know, while we're waiting for responses, I do feel like personally, I try to be there and offer a lot of emotional support for my loved ones. And I check in on them if I haven't heard from them. I invite them to events or try to plan dates with friends or my boyfriend or family. And like I said, offering love and support. I'm kind to them and just tell them that I'm grateful for them and that I love and appreciate them. So does anyone want to share? You can share how you share care, or who you share care with, or how you take care of the other people that you know. My older sister moved out of the state to be close to me. I never imagined she'd have several physical problems and need my support. It's been hard, but I am the only family she has out here, and I try to balance time with her and caring for my own family. I'm sorry to hear about her physical challenges, but you sound like a really great sister, and I'm glad that she has your support to be able to navigate. And I think that's just, showing, and also it's just reminding yourself, so offering compassion to others, and then also self-compassion, especially being a caregiver. While I'm getting I feel like that video shows that patience is a great way to be kind. Ooh, that is a really great, insightful comment. And I do think that that's definitely one way, to offer that emotional support and patience. I love that. That's a great perspective. And does anyone want to share, how can you take care of others? Maybe that's just offering a safe space with no judgment. I think someone said listening, and just lots of love and compassion. Ask people how you can support them. And take a moment to think. Again, think, share, journal. Can you extend this courtesy to those you don't know? Because oftentimes it's for the people that we know and love. But I do think, we are all a community. And if we're able to, like we talked about in the beginning, offer that to, say, strangers, maybe people, acquaintances, someone that we don't have the same intimate relationships with. Do what you can and look for ways to find support outside yourself. Yeah, I think every challenging thing I've gone through in life, I would attribute a lot of my healing, success, and recovery to, uh, just having tools, but also, creating and cultivating and fostering a support network. So I completely agree. Well, thank you for your vulnerability and for sharing. And so let's move on and learn about two young sisters. So same thing, there's going to be words on the screen to read and background music, but I will recap after. Somebody shared, one way I try to be kind is by empathizing with someone, recognizing how difficult or frustrating or stressful a situation is for someone, as opposed to only being sympathetic and talking about my own similar experience. I think that is, again, very profound and evolved. And it's definitely something that I'm working on as well. I think I'm a big, like, love real hard and protect the people around me. And I definitely, and I think I'm very empathetic. But yeah, one thing that I'm personally working on, so I love that you said that, was, I try to connect with others. So then I'll share my experience, but I don't want to take away from their experience and just move it to me. So I definitely think that's a really great reminder for all of us, and definitely including myself. So thank you for that insightful feedback. All right, so we're going to learn about, and I think this is a really sweet story and applicable or relevant to what our kindness contagion. How sweet was that? Two young sisters turned their hometown into the kindness capital of Kentucky. And Reagan and Rylan Richens, who are aged 10 and 13, saw some road signs that said, "Just be kind," on their way home from a family outing. And those messages resonated with them since their other siblings had Down syndrome, and felt that people weren't always kind to them. So these two little girls brainstormed ways to bring this message of kindness to their hometown, LaGrange, Kentucky. And they decided to create their own signs that they spray paint in their backyard and sell for $10 to donate to charities. And they've sold over 3,000 signs and raised $40,000 for various organizations, including the Humane Society and food pantries. And their kind act inspired the city's governing body to declare LaGrange, Kentucky's kindness capital. And the girls said that kindness just makes the world a better place. I completely agree. So being kind or doing acts of kindness doesn't have to be a big gesture like we've talked about today in the examples that we've given. It can be something as simple as, again, holding the door for somebody, making eye contact, smiling, telling somebody else to have a good day, complimenting a stranger, all the things we talked about. And it makes the girls happy to be kind. And this mission to spread kindness has brought them on a variety of TV shows and on a billboard in Times Square. And they're actually going to paint a mural in a new episode of HGTV, and they're writing a book together. So I'll pause if anybody has any questions, comments, or things that they want to share on any of the last discussions or video segment. Amazing. Yes, I agree. Okay, so I gathered some key takeaways from today's workshop, and I'd love to hear from you if there's anything that I didn't mention that you think is relevant, or again, any questions, comments. But you can join, create, and encourage charity opportunities, and everyone benefits from philanthropy. Again, just desire to promote the welfare of others. And maybe that's, like I said, with your time, your emotional support, your money, goods, services. Make sure that you find a method of giving that works for you and feels authentic and is something that you genuinely want to do. And kindness is contagious. Look for inspiration and inspire others. And someone said their act of kindness has improved their self-confidence. Absolutely. You just never know where your act of kindness will lead. Well, thank you all so much for the discussions and your participation and sharing and giving each other really great ideas. If anyone has any questions, I will open up the floor for a couple minutes. Any thoughts, any things you want to share before we wrap up? I'm going to give it over to Laura, Kristen, to just let you know some HealthNet resources that you have available to you. But thank you again for joining today. And I hope this webinar has inspired you to give back and spread kindness. Someone said, the family member with Down syndrome led me to think, oh, sorry. Thank you. You're welcome. Sorry, the chat box moved because someone else commented. The family member with Down syndrome led me to think about how it can really help to be mindful of where someone is at and what they have to give, and to be grateful for what they give, even if it's just a little, and to express that gratitude to that other person. That was very eloquently put, and I completely agree. Thank you for your comments.
Yeah, I'll just cover the last of the slides as additional comments are welcome to come on in. But again, that's the right slide, Katie. Thank you so much. Thanks again for Katie and their attention today. The next slides, I'm going to go over our programs that help our HealthNet members build and also maintain their healthy habits. And our members can find our wellness programs and other resources when they log in to their HealthNet account. And next slide, Katie. All right, so the health risk assessment that we offer is called the Real Age Test, and it's actually designed to give you a snapshot of your health status in several key areas such as nutrition and exercise, emotional health, and also with financial well-being, among others. It's a great place to start if you want to identify what your health habits are, and maybe there's some that could use a little bit of help. Your results also may include some recommendations as well. And to the next slide. And then healthy habits, they can be a challenge. So, don't go it alone. HealthNet offers health coaching. So that's a great way to get some support when you're trying to make some lifestyle improvements, maybe things as managing stress or eating healthier, quitting smoking or others. It really helps to have support of your friends, those around you, your coworkers, family or so, and of course the coach to help keep you motivated. And the next slide is on our Craving to Quit program. So this is HealthNet's tobacco cessation program. And this program is designed to help users who are ready to quit to permanently break their addiction to tobacco. That includes things like vaping and other tobacco products as well. And the next slide, Eat Right Now. So this is a program that helps the participants with healthy eating habits. It's not a diet. And topics in this program include things like triggers, cravings, ways to develop some healthy habits, and emotional eating is covered as well. And the next slide is unwinding. So we know that life is stressful. So if managing stress is part of your plan to build in a healthy habit, you want to look for programs that focus on ways to de-stress and help you stay in the moment with mindfulness. This program uses tools, videos, and modules that help to guide you to build resilience and hopefully decrease chronic stress. And as you can see on the slide, this program is actually open to everyone. So both HealthNet and non-HealthNet members are welcome to join the program. Next slide. Our discount. So HealthNet members, please take advantage of our discounts. We have weight management discounts such as Weight Watchers, also chiropractic and acupuncture services. If you happen to need an extra pair of prescription sunglasses or computer glasses, we have discounts on that, as well as to hearing aids, including screenings, and to our fitness clubs through our Active and Fit program. $28 a month gets you access to all the gyms in the network, as well as on-demand information as well, like videos. No contracts. You can change gyms as often as you would like to. Next slide is on the online challenges. Again, these are open to everyone. So we have a variety of online health challenges every month. Most of the topics you'll find are on stress, sleep, and steps. Again, open to everyone. In June, for HealthNet members exclusively, we've got a 90-day challenge called Green Days, Green Day Challenge. So that's where you're going to log in and document the healthy habits that you are doing. And you're looking to get a score of 60 out of 90 for the Green Days, in addition to the other challenges coming up in June as well. And the last slide here. Our next wellness webinar in June is titled Live Long, Live Better. And that's where we're going to take a look at the secrets of maintaining vitality and well-being as we age. So in this webinar, we're going to explore the art of feeling young at heart. We're going to emphasize the crucial role of movement, fostering those healthy eating habits, and keeping our minds sharp and engaged. We're going to be talking about everything from preventive health measures to the power of joy and kindness. And this session's promises to inspire you to embrace a holistic approach to aging gracefully and living your best life. Now, the date is highlighted in red because June 19th is the third Wednesday of the month, but that is a HealthNet holiday. So this webinar next month will take place on June the 12th, same time, but it's the second Wednesday of the month in June. And our next slide is just, again, thank you so much for your time today. As a reminder, everyone who registered for this webinar will receive a link to the recording in just a couple of days. And Katie, you can take a quick look and see if there were any other text messages, chats. Otherwise, we'll go ahead and close out this session.
Nope, I do not see. Give it a minute, but oh, just some thank yous. But,
All right. Again,
no more.
thank you so much for joining us today. Feel free to exit the webinar at this time.
You're welcome.